Thank you. seat. Can you kindly take your seat? The dignitaries are about to walk in. Take your seat. Kindly take your seat as the dignitaries makes their way into the room. Kindly take your seats so we can proceed with today's program. Wi-Fi, earphones, kids, Egyptians, a lot of Egyptians. Kindly make your way in. Few quick announcements. I hope most of you have seen the barcode of the Wi-Fi. Can the team pull it up again? The Wi-Fi password, and we have translation and interpretation services in this forum. We've got French, Arabic, English. You can collect the interpretation kits right outside by providing an ID. And we've got the tea break here in the foyer, as well as the washrooms next to it. Kindly have your seats as we await for dignitaries to make their way in. Thank you. Kindly be seated. The program shall start in 3 minutes. Kindly be seated. We shall start the program with our program director today, who is Dr. Abebe Genetu-Bayi, the head of local manufacturing at Africa CDC. Please be seated, and Dr. Abebe, you most welcome.
Excellencies, dear representatives of the African Union member states, representatives of the regional economic communities of the African Union, representatives of the national regulatory authorities of the African Union member states, dear African manufacturers, dear AVMA investors, international partners, ladies and gentlemen, Assalamu alaikum. Welcome to the second Vaccines and Other Health Products Manufacturing Forum for the African Union member states. The forum is co-hosted by Africa CDC, Gavi, RVMC, and the Unified Procurement Authority of the government of the Arab Republic of Egypt. My name is Abebe Genetu-Bayi. I'm the coordinator for local manufacturing at Africa CDC. I've been with Africa CDC since the first day Africa CDC started the vaccine manufacturing initiative in 2021. Today, we're gathered here in this beautiful hall in the beautiful and historical city of Cairo for the second time, for the second Vaccines and Other Health Products Manufacturing Forum. The first forum happened in Marrakesh, the Kingdom of Morocco, in 2023. Since the first Manufacturers Forum happened in 2023, we're witnessing significant progress in vaccines and other health products manufacturing, has got its mandate expanded to coordinate local manufacturing of not only vaccines, but also other health products, medicines, diagnostics, and medical. We started with a very bold goal of manufacturing our 60% of our vaccines by 2040. The African Union member states, the heads of state and government of African Union came together in April 2021 virtually in the middle of the COVID-19 pandemic and established the Partnerships for African Vaccine Manufacturing, PAVM. As you know, PAVM is now the household name in the vaccine manufacturing space in the whole world. In 2022, Africa CDC, together with partners, Framework for Action. It's a 20-year program to expand vaccine manufacturing on the continent. As we speak, the vaccine manufacturing ecosystem has significantly expanded. It expanded from a couple of vaccine manufacturers on the continent, manufacturing less than 1% of our vaccine needs, to more than 25 manufacturing initiatives on the continent. In addition, in February 2024, the African Union heads of state again expanded the mandate of Africa CDC to coordinate, lead the agenda, and convene the manufacturing of medicines, diagnostics, and therapeutics. So we have progressed from PAVM to FAM, the platform for harmonized African health products manufacturing. In addition to expansion of the mandate, the African Union member states also mandated Africa CDC, together with partners, to establish African pooled procurement mechanism. The third decision was to mandate His Excellency President William Ruto, President of the Republic of Kenya, as the champion for local manufacturing for Africa. Again, last year, we witnessed the launch of the African Vaccine Manufacturing Accelerator, AVMA. AVMA was launched in June 2024 by Gavi and Africa CDC and the government of France. And now we have progressed from setting up AVMA to implementing AVMA. So today, the objective of this forum is to discuss the progress and challenge that we have faced in the vaccine and other health products manufacturing, to unlock the barriers to success for African vaccines and other health products manufacturing, to inform course correction, and to also support the implementation of the African Vaccine Manufacturing Accelerator, AVMA, and to receive feedback for Africa CDC on non-vaccine manufacturing and on the implementation of the African pool procurement mechanism. Excellencies, partners, ladies and gentlemen, allow me to call on the first, His Excellency, Dr. Hisham Sataid, the chairman of the Unified Procurement Authority of Egypt, to give us his remarks.
Good morning. Your Excellencies, distinguished guests, ladies and gentlemen, it's my great honor to welcome you all in the second Vaccine and Other Health Products Manufacturing Forum for African Union member states. Allow me to begin by extending my warmest greetings to His Excellency Dr. Jean Kaseya, Director General of Africa CDC, Dr. Sanya, CEO for Gavi, and Mr. Frederick Christensen, Managing Director of RVMC. Your dedication and leadership in strengthening healthcare systems and expanding vaccine manufacturing capacity across Africa are truly commendable. I would also like to extend my deep appreciation to the esteemed advisor of the President of Egypt, Dr. Awad Tajuddin, Professor Dr. Awad Tajuddin, the chairman of the Egyptian Drug Authority, Dr. Ali Al-Ghamrawi, as well as Dr. Amr Kandil, Deputy Minister of Health and Population. He is representing Dr. Khaled Abdel Ghaffar, the Deputy Prime Minister, in his talk today. Distinguished guests, your presence underscores our collective commitment to strengthening Africa's health and pharmaceutical capabilities. Good morning, everyone. It is a privilege to stand before you today in Cairo, a city that has long been a gateway of African collaboration in trade, knowledge exchange, and sharing innovations. Egypt has always been a cornerstone for inter-African cooperation, and today we reaffirm our commitment to African healthcare system self-sufficiency and self-dependency. The journey towards self-sufficiency in vaccine and health products manufacturing is no longer a vision, it's a necessity inspired by the experience gained from COVID-19 pandemic. The African Union has set a bold and urgent goal to locally manufacture 60% of Africa's vaccine needed by 2040. The target is not just strategic ambition, but a reflection of our shared determination to create a resilient healthcare ecosystem for future generations. This year marks a turning point for Africa's health manufacturing capabilities with major strides in vaccine production, financing, and regulatory advancements, which represented by the launch of the African Pooled Procurement Mechanism, the ABPM, a transformative initiative that supports Africa production capacity by ensuring demand certainty and market sustainability. And plus unprecedented funding commitments, over $5.5 billion is pledged in investment and reaffirming global confidence in Africa's ability to manufacture high-quality health products. Also, the major regulatory advancement, with more African regulatory authorities attaining WHO maturity level 3, ensuring the highest quality standards in locally produced healthcare products. Egypt stands at the heart of this transformation with nearly 20% of Africa's vaccine manufacturing capacity. Egypt is hosting 6 manufacturers on track, expected to produce not less than 380 million doses per year by 2030. At UPA, Unified Procurement Authority, we see the value-based procurement as a catalyst for change. Our role extends beyond unified procurement. We foster economic sustainability, market growth, and encourage industrial local innovations. We are committed to optimizing resources through value-based procurement, fostering a competitive and transparent marketplace, preventing monopolies, advancing health technology assessment, the health technology assessment and health economics to drive an evidence-based procurement to maximize the impact, expanding G2G partnership with other African procurement entities in Africa, positioning Egypt as a reliable partner for vaccine and essential health products for the African market. One of the most powerful tools in achieving these goals is the African Pooled Procurement Mechanism. By consolidating demand, the APPM ensures that African manufacturers can thrive and Africa has self-sufficient access to life-saving vaccines and other healthcare services. UPA is committed to playing a key role in supporting the ABPM initiative, cooperating with other African procurement authorities and entities, implementing proper programs and mechanisms for achieving the ultimate goal of self-dependency, self-sufficiency. The forum is more than just a gathering of leaders. It is a defining moment for action. We must turn our vision into timed action plan. The responsibility lies within us to drive meaningful change by prioritizing African-made vaccines, streamlining regulatory processes, and investing in infrastructure to build self-reliant Africa. Africa is not on the sideline of global health anymore. It's ready to lead. The time to act is now. Mr. John Kaseya was just telling me, let's make Africa great again. That's right. Thank you very much.
Thank you very much, Your Excellency. Allow me to call His Excellency Dr. Ali Gamarawi, the chairperson of the Egyptian Drug Authority. He will give us his opening remark on behalf of the national regulatory authorities in this room.
Bismillah ar-Rahman ar-Rahim. Your Excellency, Dr. Mohamed Awad Tajuddin, the advisor of the President of Egypt for Health and Preventive Affairs, Dr. Ashraf Hatem, Chairman of the Health Committee in the Egyptian House of Representatives, Excellency Dr. Hisham State, Chairman of the UPA, His Excellency Mr. Wamkil Kibitsui Mane, Secretary General of African Continental Free Trade Area, Dr. Sania Nesher, Gavi Executive Director, and Dr. Jean Kassia, Director General of African CDC. Esteemed colleagues and distinguished guests, good morning, everyone. It's truly an honor to be here today at this significant event. I would like to extend my deepest gratitude to UPA for their unwavering commitment to the strategic vision of the regional manufacturing of essential health products in Africa. In a world interconnected by trade, science, and shared challenges, it's imperative that Africa strengthen its own pharmaceutical and health products manufacturing. COVID-19 pandemic was a stark reminder for how Africa was pushed to the back of the queue for life-saving vaccines and treatments, reinforcing the urgent need for self-reliance. This crisis affected more than 777 million people worldwide and claimed more than 7 million lives. While 5.6 billion people received the vaccination, Africa struggled to secure timely and sufficient supplies, exposing a harsh reality. Reliance on external sources leaves us vulnerable in times of crisis. This moment in history has catalyzed a collective drive toward Africa for Africans, ensuring that our continent can meet its own healthcare needs with little dependence on external sources if possible. The Egyptian Drug Authority has been instrumental in creating a dynamic and supportive regulatory environment that enables our industry to thrive through robust oversight, streamlined regulations, and strategic collaboration with industry partners. The EDA ensured that our pharmaceutical sector operates with the highest standard of quality, safety, and efficiency. This has positioned Egypt as a key player in regional pharmaceutical manufacturing, providing life-saving medication and essential health products to African nations and beyond. Egypt's leadership in pharmaceutical regulation further underscores our role in shaping the continent's pharmaceutical landscape. The World Health Organization, ensuring that Africa's voice is heard in shaping global health policies. Ladies and gentlemen, as we stand here today at this remarkable event, we are not just discussing the future of regional manufacturing of health products. We are actively shaping it. Egypt, alongside its African partners, is committed to fostering sustainable, self-sufficient healthcare ecosystem that will drive progress toward regional health coverage and strong, healthier, and more resilient Africa. The Africa we want, the motto of Africa 2063 agenda. Thank you.
Thank you very much, Your Excellency, Dr. Ali. A round of applause for Egypt and EDA for achieving ML3 for vaccines and medicines. Congratulations, EDA. Now, allow me to call His Excellency Professor Awad Tag El Dain, Advisor to the President, the Arab Republic of Egypt. Thank you.
Bismillah ar-Rahman ar-Rahim. Good morning, everybody. Bonjour, monsieur, madame and monsieur, et monsieur, which is the African Union COVID-19 Response Fund for management of the problem of COVID-19 and availability of vaccines for the African peoples. Urgent need for vaccinations. From our deep experiences with my colleagues in Africa and CDC, African CDC, and ministers of health in different countries in Africa, I think practically and actually we need strong cooperation, because the experiences during the last 5 years and the problems of availability, affordability, and accessibility to vaccine was a major problem. I think, and also I am former Minister of Health of Egypt, this is the first time during the COVID-19 pandemic there is affordability for vaccines, especially COVID-19 vaccines. But at that time, there is no availability. And sometimes when the vaccines are available, there is major problems for implementation of massive vaccination of the African peoples. When I was in my office as a Minister of Health and the Population of Egypt, and during one of the activities of WHO in Geneva to attend the General Assembly, at that time they invite Bill Gates to give presentation at the Assembly. And Bill Gates gave a lecture for 1 hour about his donation, Gates and the Melinda Institute, to support vaccination, and they work only for HIV/AIDS. And I told, as intervention with Bill Gates, you are donate for HIV/AIDS, which is good. But this disease is preventable, treatable, and not curable disease. But Africa is complaining from major diseases, which is preventable, treatable, and curable. And I give him example of malaria, tuberculosis, and the other disease. And they make a long research. They respond to our suggestion for giving donation for the chronic problems in Africa. Did you think, this is a question, which continent represents 14% of the world population, but only 0.1 of the world's vaccine production? This is Africa. The answer is Africa. Fewer than 10 African countries are self-sufficient in vaccine procurement, and most continue to rely on UNICEF and Gavi. The Vaccine Alliance for the supply of routine vaccinations, totaling over 1.5 million doses annually. This over-reliance on external supplies amid the COVID-19 pandemic has further scored the urgent need for locally produced and accessible vaccine as public health security measures. The pandemic has also progressed, led by the African leaders, with a good pledges for manufacturing of vaccine in Africa. And up till now, still we have a major problem for that. Did you think we have manpower, we have facilities, we have the desire to manufacture vaccines in Africa? My answer is yes, you can. Vaccine security in Africa, which way next? Brought together researchers, policymakers, pharmaceutical and biotech companies, civil society organizations, and the media to discuss and advocate for pathway towards a sustainable vaccine development and manufacturing in Africa. You can. Innovative financing approaches and domestic mobilization. Forum participants also lighted opportunities to accelerate vaccine development and manufacturing in Africa. Establishing a vaccine manufacturing capacity in Africa has emerged as only sustainable solution that can generate security of vaccine supply in the fight against vaccine-preventable diseases and also in the fight against pandemic diseases. Still, we have not only COVID-19, still we have many problems in Africa needs the manufacturing of vaccine. The African Union COVID Response Fund has been established in April 2020. Me personally was elected as representative of North Africa and then also elected as a vice chair. And we have at least 35 meetings with CDC and the African Union. We have fund, but as I told you, sometimes we have the money, but we have no vaccine. And even sometimes when we receive the vaccine, it's more or less near to be expired. And sometimes we have the vaccines and the raw keeping material to keep the vaccines. And sometimes we have no proper distribution of this vaccine. Projections and costs, financing and additional resource requirements for African countries, immunization programs over the decade 2025 and 2030, with strong, continuous political support from the African leaders and the close supervisions and follow-up, we can reach our goal. We appreciate very much the support of His Excellency, President of Egypt, President Fattah el-Sisi, because he is now putting the health and education as a first priority, and the manufacture of vaccines and pharmaceuticals and the medical equipment for Egypt and Africa. One of the priorities of political commitment with progress of Egypt and Africa. Dear colleagues, let us work together, hand in hand, to achieve our goals and build a better future for our beloved Africa. Thank you very much for your kind attention.
Thank you very much, Your Excellency. Thank you for your contribution in pushing the agenda of local manufacturing in Africa. So now allow me to call the Chief Executive Officer of Gavi, the Vaccine Alliance, Dr. Sania Nishtar.
Honorable Ministers, Excellencies, partners, our donor partners, friends from the press and media, my own colleagues, ladies and gentlemen, a very good morning to you and Assalamu alaikum. On behalf of the Regional Vaccine Manufacturing Collaborative, on behalf of the Africa CDC, on behalf of UPA, our partners, I wish to welcome you to the second African Vaccine Manufacturing Forum. And I want to thank the government of Egypt for extending us all the wonderful hospitality that we are all enjoying today. This is your forum. This is an opportunity for you to discuss where we are in our journey with reference to vaccine manufacturing on the continent. This is your opportunity to discuss where we are 1 year on from having announced AVMA. We're very open to hearing your thoughts. We're very open to discussing collaboratively how we wish to move forward from here. And I want to thank in particular the 13 donor partners who made $1.2 billion available for the African Vaccine Manufacturing Accelerator, which is why our conversations today are so concrete, so substantive, and so grounded in reality. I really want to thank our donor partners today. Excellencies, I come to Africa with humility and respect. Me and my partners, all the donor partners, come to Egypt with humility and respect. We are all very supportive of a vibrant, sustainable commercial vaccine manufacturing sector on the continent. We are very supportive of your aspirations to achieve self-sufficiency in vaccine manufacturing. And we realize that this goal will only be achieved when there is African leadership, when there's full African commitment, and when there is capacity on the continent. And in humility, we are here to support you in whatever small way that we can. I want to make 3 points today. The first point is about what it will take to achieve your aspiration of achieving self-sufficiency. And I think here we must recognize that the aspiration of vaccine self-sufficiency is something that will take a multi-sectoral effort, a true multi-sectoral effort. It will involve governments creating the right enabling policy environment, giving the right incentives to manufacturers and investors. It will entail the governments investing in building the right capacity at the regulatory level, at the human resource level. It will entail Africa as a continent coming together to ensure that you have the right upstream considerations in place, particularly with reference to raw material that will sustain and make this aspiration of self-sufficiency a reality. It will require the creation of appropriate demand from within Africa more than anything else. And of course, there is a role of the private sector. There is a role for investors, and there is a role of international agencies. At the international agency level, we work as a well-coordinated group with roles for WHO, with roles for many of other entities, and as far as Gavi is concerned, we are the stewards of the vaccine pillar. and we want to play this role well, which brings me to the second point. My second point is about the role of Gavi in this entire multi-sectoral effort. One of our brothers talked about Africa not being at the back of the queue, and we couldn't agree more with you. When the next pandemic happens, and unfortunately that's not a question of if, it's a question of when, we must make sure that Africa is not at the back of the queue, which is why we're here in this room today. Now, learning from that experience, Gavi, with the support of its donor partners, put in place what it's called the African Vaccine Manufacturing Accelerator. This is an innovative financing instrument. It's a $1.2 billion facility spread over a period of 10 years. The purpose of AVMA, as we popularly call it, is to promote commercial and sustainable vaccine production on the continent, to bolster local vaccine manufacturing here in Africa. And AVMA is meant to provide two kinds of payments. The first payment is a milestone payment, and any manufacturer which achieves a PQ for one of the priority vaccine antigens stipulated in the AVMA framework will receive a milestone payment. And the second set of payments are called the accelerator payments. These are payments from 30 to 50 cents a dose, depending on the antigen, and these payments will be made to any manufacturer who competes in our tenders. I'm very pleased to be able to let you know that I'm not telling a story here. I'm not talking about an aspiration. We have the money available today with us to be able to catalyze this ecosystem as soon as a manufacturer is eligible. This instrument is predicated on the understanding that when vaccine manufacturing kicks off in a new area, in a new continent, in a new country, by a new manufacturer, there are startup costs. And the way AVMA has been structured is to provide you a subsidy, to make you competitive, to underwrite part of your costs. And I would once again like to emphasize that we are ready to kick off with this instrument as soon as a manufacturer is eligible to apply for it. And that's the second point I wanted to make. The third point, excellencies, friends, ladies and gentlemen, I want to make is about what it will take to make it successful. I want to pause here, and I want to pause here for emphasis, and I want to say with emphasis here that the future of vaccine manufacturing on the African continent and the success of Gavi are deeply interlinked. And I want to repeat this, because we all must understand this. The future and the success of African vaccine manufacturing on the continent and the success of Gavi are deeply interlinked. Because if Gavi will fully function, will be fully replenished and have the volumes that it purchases today, it will provide an opportunity for the African manufacturers to cut in. So it is in our collective benefit to work together towards a successful replenishment. Our replenishment event is going to be hosted by the European Union and the Bill and Melinda Gates Foundation on the 19th of March in Brussels. Each one of you is a Gavi ambassador, and our futures is deeply interlinked. And I invite you to participate with us to support Gavi's replenishment and the success of vaccine manufacturing in the continent, and the success of your dream of vaccine sovereignty for the African continent. These are all deeply interlinked. We all have a desire to make sure that Africa is not at the back of the line when the next pandemic unfortunately hits. And I can assure you that at Gavi, we are fully supportive of that. And in humility, in respect, we stand behind your leadership to make sure that that aspiration becomes a reality. I thank you.
Thank you very much, Dr. Sania Nishtar. Next, allow me to call the Managing Director of Regionalized Vaccine Manufacturing Collaborative, Dr. Frederick Christensen.
Dear Excellencies, colleagues, friends, ladies and gentlemen, it gives me a tremendous pleasure and it's an honor to join my esteemed partners from the Africa Center for Disease Control, Dr. Jean Kaseya, from Gavi, the Vaccine Alliance, Dr. Sania Nishtar, our hosts represented by the Unified Procurement Authority, Dr. Hisham Stait, to welcome you all to this second Vaccine and Other Health Products Manufacturing Forum. Now, gathering here in Africa, the cradle of mankind, and having had the opportunity to visit the pyramids and the city and the Egyptian Museum over the last few days, it reminded me not only of Egypt's millennia-old culture and how it has influenced, and of course been influenced by other cultures, like the Mesopotamian, the Greek, Roman, Nubian, and other African cultures. It reminded me very deeply of the common roots that we have and how intertwined our lives are. Not only during pandemics, as we've just lived through, but at a deeper human and cultural level. And I think this interconnectedness is the basis for our forum. And we are building, in fact, on the 1948 Universal Declaration of Human Rights, which said that all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards another in a spirit of brotherhood. So I find gathering here in Cairo, Egypt, Africa, is a very befitting backdrop for this forum to inspire us to take significant steps towards ensuring a more equitable distribution of vaccines and other health products across Africa and across the globe. But as we convene here today, the world is clearly not unified. The unfolding Mpox outbreak serves as a stark reminder that we have not progressed much since the COVID-19 pandemic in terms of equitable access to needed health products. There are almost 1,500 registered deaths at this point, and almost still 500,000 children dying from vaccine-preventable diseases every year. And behind every statistical life, there is a very real human being, often a young person or a child, his or her family, and a whole community whose lives have been impacted. So infectious diseases, emerging and re-emerging diseases, will continue to threaten our lives and livelihoods, our economies, societies, and our efforts are now being complicated by the impacts of climate change, the risk of willful misuse of biological knowledge, the partly willful spread of misinformation. So global health is clearly facing very challenging times with a lot of different crises competing for attention. However, not everything is doom and gloom. This forum is a testament to our collective drive towards countering some of these challenges through regional collaboration, and Africa CDC's Partnership for Africa Health and Medical Advancement has drawn up a roadmap. Gavi's AVMA is a very concrete instrument in support of that agenda. So let's use the coming days to continue to transform political will to actionable plans as time is getting short. And let's explore how to support the regionalization, not least through how we secure and sustain predictable levels of demand on the continent for regionally vaccine manufacturing products, and ensure a more effective and harmonized regulatory framework across. Such developments would provide manufacturers with the necessary trust to develop, manufacture, and distribute the products the region needs. So during the next 2 days, we must also confront some difficult issues, such as the fact that not every country can be self-sufficient, but needs to be dependent on others within the region, as well as the fact that no region can truly be completely self-reliant. So to develop regional solutions, we need to discuss across vaccines, drugs, and diagnostics, and we also need to consider the whole value chain from R&D, clinical trials, through to delivery, and use those aspects to be the basis for developing collaborations within the regions, between regions, and with global partners, but on regions' terms. So I think if our discussions over these next 2 days contribute to that, then we will be en route to creating a more equitable and resilient global health system in that spirit of brotherhood set down in 1948. So I wish us all a very inspiring and productive forum. Thank you.
Thank you very much, Dr. Frederick Christensen. Now we will proceed to a video recorded message from His Excellency, Dr. Wamkele Mene, the Secretary General of the African Continental Free Trade Area.
Dr. Jean Kaseya, Director General of Africa CDC, Honorable Minister Abdel Gaffa, Minister of Health and Population of the Arab Republic of Egypt, Honorable Ministers, distinguished ladies and gentlemen, it is a pleasure to join you for the second edition of the Vaccine and Other Health Products Manufacturing Forum to be held in Cairo, Egypt. I want to take this opportunity to congratulate all of the stakeholders for their commitment to advancing this very important objective. According to the World Economic Forum, the African market for vaccines and medicines is valued at over $50 billion annually, but the continent imports most of the healthcare products that we consume. We must reverse this trend, and we must use all available tools, including, and more importantly, including the AFCFTA, to reverse this trend. This meeting today provides an opportunity to refine our strategy, our plan, and our vision for regional manufacturing of essential health products in Africa, particularly in light of recent policy developments that support our ambitious goal of producing 60% of Africa's vaccines by the year 2040. In this context, the AFCFTA Secretariat is fully committed to collaborate with Africa CDC under the very able leadership of Dr. Jean Kaseya to implement the decision of the 37th Ordinary Session of our heads of states to establish a pooled procurement mechanism for medical products from African manufacturers. This mechanism will support local pharmaceutical production and trade in locally produced pharmaceutical products. We are therefore committed to providing the necessary trade policy support through the various protocols of the AFCFTA to ensure that we reach our ambitious objective. The Protocol on Intellectual Property Rights, which was adopted by the African Union Assembly of Heads of States and Government in 2023, establishes a framework to encourage innovation and safeguard investments in Africa's pharmaceutical sector. A balanced intellectual property rights system protects patents, promotes research and development, and makes Africa a more attractive investment destination for production of pharmaceutical products. We are also ensuring that there is effective implementation of another very important trade policy tool, and that is rules of origin. Rules of origin enable us to foster industrial development in Africa, to ensure that we encourage industrial development by requiring that there is a minimum threshold of local production in Africa in order for a product to be made in the AFCFTA market. However, the challenge that lies ahead will not be solved only by rules of origin. The key challenges that we confront in registration, harmonization, and mutual recognition of regulations and standards for pharmaceutical products is a matter that we have to tackle with urgency. Digital tools such as online procurement platforms and electronic tracking systems will enhance transparency, quality control, and ensure that we have efficiency in trade in pharmaceutical products. To facilitate a sustainable vaccine and pharmaceutical manufacturing sector in Africa, to boost health systems and economic growth, we require adequate trade finance. Closing the trade finance gap requires a collaborative effort, multi-stakeholder strategy to mobilize adequate funding and ensure the sector's long-term viability and competitiveness. As I conclude, let me state one more point, and that is developing vaccine and health product manufacturing in Africa will require strong leadership by the African Union and its organs or agencies. And in this regard, I'm very, very pleased with the strong partnership and the strong leadership that Dr. Jean Kaseya and his team at Africa CDC continue to provide to the entire continent. The AFCFTA Secretariat remains committed to partnering across sectors to enhance access to quality medical products, strengthen intra-Africa trade, contribute to intra-Africa's industrial development by ensuring a viable vaccine manufacturing and pharmaceuticals manufacturing sector in Africa. I wish all of us very good deliberations over the next 2 days. I thank you very much.
Thank you very much, His Excellency Wamkele Mene, the Secretary General of AFCFTA. AFCFTA is one of the organs of African Union and working on trade facilitation, which is one of the pillars of implementing local manufacturing on the continent. Now, allow me to call His Excellency Dr. Jean Kaseya, the Director General of Africa CDC, to make his remarks.
Thank you. Good morning. I know that my predecessors, my sister, Dr. Sanya, was leading Gavi. My brother, Dr. Esham Setait, the chairman of UPA, and Dr. Frederick was leading RVMC, already welcomed all of us on behalf of our joint collaboration for this second edition of the meeting that we have in Cairo. Excellencies, dear friends and colleagues, I want to take this opportunity to say that it's a great honor for me, on behalf of my colleagues from Africa CDC, to attend this important gathering where we are coming together to explore the future of local manufacturing in Africa, a key step in advancing health security and self-reliance on our continent. I'm proud to represent an institution with a clear vision on how to support the prevention and control of diseases across Africa. As an autonomous health institution of the African Union, we have the responsibility to drive the continent's health agenda and to enhance preparedness and response to disease and public health emergencies. As we move through 2024, we faced so many challenges. The continent is experiencing a significant rise in public health events, from 152 public health event in 2022, we had 2,013 outbreaks in 2024. That is an increase of more than 40% of outbreaks in 2 years. We had to face mpox, cholera, Marburg, measles, and so many other outbreaks, in addition to some humanitarian situations like what we're experiencing in the eastern part of DRC. I have to call that a bomb for the continent in terms of implosion of major outbreaks. If we have to remember that they are living in an area of 75 square kilometers, giving a population density of 39,620 people per square kilometer. If Goma was a country, it will be the most country will have the highest population density in the world. These people are living without to stop this war. Last week, I sent a letter to all African heads of state and government to call them to stop this unnecessary war. That can lead, if we don't pay attention, to a major outbreak, even to a pandemic. The epidemiological situation I was describing are fueled, in addition to the insecurity, by other factors like lack of medical countermeasures, vaccines, therapeutics, diagnostics, also by inadequate funding to our system, health systems, to lack of skilled health workers and more the structured health systems that are not digitalized. In 2025, to this alarming situation described in 2024, we need to include some new external factors, such the decrease of foreign development investment from 80 billion US dollars in 2021 to 24 billion US dollars in 2025. This is a huge decrease of 70%. We need also to add to that the increase on the debt servicing challenges that many African countries are facing, including Egypt. Africa will spend 81 billion US dollars on debt services between 2023 to 2025, while getting less than 50% in terms of foreign development investment. We need also to add to this figure that is so miserable the tendency we see from many countries to withdraw from some international organizations, even to cut budget to some of others' organizations. All of that, ladies and gentlemen, pushed Africa CDC to do a kind of modeling and to know what will be the impact in 2025 and beyond. We are expecting, if we don't change this trend, to have additional 2 to 4 million people dying additionally. Additionally, 2 to 4 million people. We are expecting to see a loss of billions of dollars in our economy. We are expecting to see 39 million more people falling into poverty, and we are maybe facing the risk not only of a pandemic, but of a failure of our political systems in Africa. Africa's pharmaceutical market is currently valued around $50 billion, ranging from $40 to $60 billion annually. But we know the black market is playing a key role. This is why, with our projections with AFCFTA, we are thinking that by 2040, this market could represent $260 billion, serving a population for 1.4 billion, that will become 2.5 billion in 2050. We believe this is a major opportunity for the continent, but we are still facing a number of challenges. Fragmented market, lack of information that limit African countries to commit to buy African product, barrier to technology access, financing, and human resources. We believe that while these barriers are there, the continent, with the 500 manufacturers that we have, is not saturated, as some people are saying. Africa CDC has made remarkable progress in 2024 in transforming the local manufacturing landscape. As you see in many decisions from AU, we moved from PAVM to FAM. My colleague was talking about it. It means we are not just considering vaccine, we are considering all health commodities for local manufacturing. We managed to secure AVMA, and I think my sister Sanya was here. It was tough, but she was strong to get it. We managed to secure also funding from Africa CDC. Yesterday I was meeting my brother Orama to say, we need more funding. But as my sister Sanya said, AVMA money is available. It's up to us as Africans to use that opportunity. We signed a number of MOUs with UNICEF, with PAO, Pan American Health Organization, to see how we can learn from others to make our agenda moving. We also finalized the African pool procurement mechanism. Let me be clear and loud. When we are talking about African pool procurement mechanism, we are talking about all health commodities, not only vaccine. We want a medicine from Egypt not to take again 2 years to be sent to Zambia. This is not acceptable. It will never happen again. We also did what we call the African manufacturing landscape. That gave us opportunity to know for the very first time how many manufacturers we have in Africa, component per component. Delegate, one of my colleagues, Director General of AMA, while we are recruiting a substantive Director General. No need to share with you, General. This is showing our commitment to operationalize AMA. We are also working, I know some colleagues from WHO must be here, with WHO on the pre-qualification process. In the past, we were thinking that the pre-qualification was a major limitation for us to achieve our goal of local manufacturing. I think we have a positive discussions with our colleagues to see how to move forward. Let us also celebrate the way that we managed to bring from 2 to 4 NRAs 2 years ago to 8 NRAs with ML3 status. One of them, that is Egypt, is the only one from now having ML3 for vaccine and medicine. In 2025, we want to see this figure changing again. We did a lot with AUDA NEPAD and so many other partners to support our NRAs in Africa. We supported the tech transfer, and today we managed to put in place, after a tough competitive process, what we call the Africa CDC Regional Capacity and Capability Network. That is the game changer. Because for the very first time, we are bringing everything together. And this is what we call the ecosystem for local manufacturing in Africa. We are also working with our colleagues, as His Excellency Wankele said, the Secretary General of FCFTA, to facilitate the supply chain for raw materials and also to facilitate trade in Africa. while we are ensuring market access for African-made health products. Let us talk about money. We already discussed that. What is the feedback I got from our colleagues from RVMC, our African manufacturers? They were telling me, DG, what you did is so good, but we still think that we have some barriers. What are these barriers? I think this is the opportunity to discuss that. We need to know what is not helping African manufacturers to move forward. To conclude, I have a call to action for all of us. Africa is ready to lead. Let me say it differently. Africa is leading the charge in local manufacturing. To do so, we need the respectful partnership of the international community. We don't want them to lead us. We want them to follow our vision. We need to see our partners establishing targets with us to procure a reasonable portion of health products from African manufacturers. We want also, as Africans, a number of leaders are here, we need to prioritize African-made health products. We need to do that by changing our policies. I will take opportunity on the margins of the AU Assembly to talk with our head of state and all of our ministers who will attend this meeting in Addis Ababa about the need to accelerate the change of our policies to procure African products. To all of us, this is time. There is no better time to support African manufacturers by encouraging technology transfer, by providing tailored financing solutions like AVMA, but we also have other mechanisms that we can put in place. Ladies and gentlemen, the road to self-sufficiency and resilience in Africa's health sector is long, but the steps we take today will shape the future of the continent. Africa CDC, together with Gavi, RVMC, WHO, UNICEF, and all other partners, supported by the strong vision of our leaders, Africa CDC is committed to leading this transformation. But we need all of you. We need all of you to continue this wonderful collaboration that we are putting in place and to make Africa safe and developed. I thank you.
Thank you very much, DG. Thank you for your leadership. Now, allow me to acknowledge some of the dignitaries in the room. His Excellency, Minister of Science and Innovation, the Republic of South Africa. His Excellency, Minister of State, the Republic of Uganda. The Permanent Secretary of the Republic of Kenya. The Permanent Secretary, the Republic of Zambia, and distinguished representatives of the Ministers of Health of other AU member states in the room. Now, we're going to the final speech. The keynote speech is by His Excellency, Dr. Amro Kandil, Deputy Minister of Ministry of Health, the Arab Republic of Egypt.
Bismillah ar-Rahman ar-Rahim. Good morning. Dr. Hisham Estate, Chairman of UBA, Dr. Ali Ghamrawi, Chairman of IDA, Dr. Muhammad Awad Tajuddin, Advisor of President for Health and Preventive Affairs, Your Excellency Dr. John Kaseya, Director General of Africa CDC, Your Excellency Sina Nishtar, the CEO of Gavi, Dr. Frederick, the leaders of the RVCM. Ladies and gentlemen, distinguished guests, and esteemed colleague, on behalf of His Excellency Dr. Khalid Abdel Ghaffar, the Deputy Prime Minister and Ministry of Health and Population, it is my honor to join you today at the second Vaccine and Health Product Manufacturing Forum for African Union member states. As we convene here in Cairo, highlights Egypt's significant achievements in the immunization system and the health product manufacturing. Through our expanded program of immunization, Egypt has successfully implemented national strategic plan to ensure all children, including non-Egyptian residents, receive essential vaccinations. This program has achieved remarkable successes within over 95% vaccination coverage and the administration of about 70 million doses of vaccine annually. Notably, Egypt has eliminated polio, neonatal tetanus, measles, rubella, and 2 months ago achieved the regional target of hepatitis B control in children under 5 years old as the first country in the region. Through the presidential initiative Meet Million Saha, Egypt reached a golden tier of hepatitis C elimination as the first country in the world. The main pillar to reach this achievement is the local production of hepatitis C treatments medicine in Egypt by very cheap costs. Ladies and gentlemen, during the COVID-19 pandemic, African countries faced significant delay and inequity in accessing crucial resources like vaccine, medicine, diagnostic. Based on the lesson learned from the COVID-19 pandemic, Africa has recognized the importance of localization vaccine production. In the line with this vision, Egypt is moving toward becoming one of the countries manufacturing vaccine in Africa. Esteemed attendees, Egypt has significantly invested in health manufacturing sector, forming partnership with leading global organizations to enhance local production capability and establish manufacturing facilities equipped with advanced technology. A recognition of its capacity, Egypt was selected by the World Health Organization as one of the 6 countries to receive technology transfer for mRNA vaccine manufacturing. The Egyptian Drug Authority has achieved WHO maturity level 3, indicating a significant advancement in our regulatory capability. Furthermore, we have established the Egyptian Vaccine Manufacturer Alliance, EVMA, a pioneering collaboration between the Ministry of Health and Populations, UBA, and EDA, and vaccine manufacturers. This alliance aims to develop a fully integrated vaccine ecosystem, strengthening local vaccine manufacturing as a cornerstone of Egypt's future healthcare system. Recognizing this importance of innovation, Egypt prioritized research and development, promoting the partnership partnerships between the research institutions and the private sector to develop new health products tailored to the need. Also, we understand that a skilled workforce is essential for achieving our goals. Egypt is committed to investing in workforce development programs to train and upscale our professionals in the health manufacturing sectors. Esteemed attendees, I believe that the collaboration with African CDC, Gavi, and the RVMC and the other partners and the country is crucial. By sharing best practice, experience, and resources, African countries together can build a resilient health manufacturing ecosystem that not only addresses our needs, but also supports the continent's health security. As we move forward, we remain committed to enhancing our health system, ensuring that every citizen has access to vaccine and health product. I thank you.
There's no other witness than Egypt to say that local manufacturing is a basis for promoting health and fighting infectious disease on the continent. You've seen from His Excellency's speech that Egypt has come all the way to getting the clearance for eliminating hepatitis C through local manufacturing and end-to-end approach. Congratulations, Egypt. Now we've come to the end of the first session. I thank you all, Your Excellencies, who have made remarks and opening speech. We don't go out without taking the memory with us. So it's time for a group photo, and I call the dignitaries sitting in the first row to come upstairs for a group photo before we move to the coffee break. Coffee break is for 20 minutes. Please allow us for the dignitaries to take the photo, and then we go to the coffee break. Thank you very much. Shukran.
Thank you, Your Excellencies. You can make your way to the VIP holding room. And distinguished guests, just 20-minute tea break and we shall be back to start our sessions. Thank you.
تيست بوديوم يمين. تيست شمال. ليفت رايت. اوكي ليفت رايت. ايوه تشيك اول واحد. تشيك. تشيك نايس. نايس تيست. تيست 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 تيست. بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. الترنك الثالث. نفس الترنك سعادتك. نفس الترنك الرابع.